A question for myself, though.
Yes.
For about the last month, I have been having some problems with my left leg. It's like a pain that is not regular and
Okay.
generally on the outside and sometimes on the inside part of the leg. Uh, it can happen day or night. It happens, I can be sleeping on my left side or right side, and the problem comes up. Uh, I've been to a chiropractor, and the chiropractor says, oh, it's probably your lower back. I happened to be at my doctor, and I asked him about it, and he says, it's probably your lower back. I don't feel anything at all wrong with my lower back. I'm not ruling it out. But I went to my acupuncturist today, and she said there were some of my some more severe blockages in my stomach channel than usual.
Okay.
And she's done some things for it. What else might I do?
Okay. So let's get a little bit more specific. So it's on the outside of your leg, like it's like mid thigh, your upper thigh, your lower thigh on that side.
It's upper to mid thigh,
Okay.
outside, and occasionally on the inside of the thigh.
In that same area.
Yes.
And when you sleep, does it hurt like when you're laying on your side?
Sometimes, but not always.
And does
When
it hurt on the side or like more? Do you ever get like an achiness up in the hip? Like not like right on the socket, but like close to the socket.
Not, I get more of that when I'm laying flat and move the
Okay.
leg, then the
Okay.
hip area tends to hurt. And once the pain comes at night, if I put a pillow between my legs, that will minimize the pain. And
Okay.
I've been sleeping with a pillow between my legs, but it's only 80 in the house and,
Yeah.
not very comfortable.
And which leg is this? This is your right
Left
leg or
leg,
your left
left
leg?
leg.
Okay. And okay, so on the inside, the outside.
I even sometimes feel it in the lower leg, and I do occasionally feel it in the ball of my foot.
And when you feel it in your lower leg, it's down the back of the leg or on the shin?
It's would be the outside back corner, so to speak.
Okay. Yeah. Yeah, like so the reason why they're saying low back is that the back doesn't necessarily have to have like a tightness or a soreness, but what happens is as something starts to compress or entrap a nerve, the nerve kind of like puffs up a little bit, and then as it keeps going down the pathway, like when there's a moderate amount of pressure on a nerve, it causes the nerve to be excited. When there's a lot of pressure on a nerve, it goes to sleep. And so what happens is, like, if you put the weight of a nickel on a nerve, it starts to puff up. And so it doesn't necessarily have to be bone, it can be muscle. But probably a lot of times when they say low back, they're thinking that there's maybe a little bit of a herniation or a degeneration, some like sort of spasm.
Right.
I tend to like to treat the whole thing. Like, because sometimes it can just be like maybe something that's in the hip or the pelvis. I mean, that they're saying low back, that's a pretty solid answer. But you want to take some spasms out of the low back, and that could be done a couple of different ways. You could do the marjoram, you could do the pain relief neuropathic. Anytime you put peppermint or corn mint on the spine, it helps to reduce like nerve pain or potential nerve pain, but it's also antispasmodic and it's a bit anti-inflammatory. And even though you're not quite feeling it there, but my guess is that it's like a chain reaction. Like, you have your back, then you go into the hip. And one of the things that I was asking for when you lay on your side is that it doesn't sound like you have this, but I still want to talk it out just in case. But
Okay.
like when you lay on your side, it's usually the side that's up. It's not always the side that's down, but because the leg is going like at a greater angle, you're laying and your leg is passing past your midline, like when you're sitting, you're standing, both legs are kind of in their spot. But when you're laying on your side, the leg on top tends to cross over the midline and is a little bit more stretched. And there's a little ligament that goes from the pelvis to the aspect of the top part of the femur that will get stretched and irritate some of the muscles in and around there. And they can cause a chain reaction like this. And, it doesn't even mean that there's something wrong. It's just that sleeping position causes some irritation. You're maybe lacking a little bit of tone in a particular area. I don't even know that that's that big of an issue, except that it's causing pain. But when you see it causing an issue down the side of your leg, it sounds like it's the outer part of the quadricep or the iliotibial band itself, which is a big tendon that runs along the side of the leg. And then you're getting some on the adductor, like on the inner part of the thigh. So most likely there's a little bit of probably a postural alignment. And, that's the thing that can happen sometimes when you get an adjustment, like standing, you might be fine, but then sitting, you kind of go back into a posture. Like, you keep correcting it, but you lay down, you're taking, the tension of gravity off and the body will go into an even different position. And
Right.
so I would go through and we were going to explore this aspect a little bit, but we can do it right now, actually. So what you want to do is, I talk about fascia and fascial release and things like that, but really what you're starting to look at when you want to go deeper with fascial release is there's muscles that work with each other and there's muscles that work against each other. And part of the issue is that there starts to be like these little imbalances that can happen where to release it, you work the muscle and then the muscle that opposes it. And you're kind of trying to bring like a balance of it. And in doing that, you can stabilize the hip, you can stabilize the leg, you can stabilize the hip flexors and all of that. And so let's just do a little preliminary, like a little run through right now. And so you could use, and let's have everybody do it. So grab, if you have fascial release, if you have wintergreen, if you have marjoram, if you have spikenard or valerian, basil, petitgrain, helichrysum. Helichrysum's a good choice. Let's see what people have with that, and we can keep going down the rabbit hole. And Robert, are you having pain right now, or even if it's not pain, does it feel a little uncomfortable right now?
No, right now it's fine. I
Feels
had
good.
that acupuncture treatment this morning.
Okay.
But it's weird because I can be sound asleep, everything's fine, and then, like you said, it's almost like something
Then it fires off.
spasms.
I suspect it's something's happening in like a position when you're sleeping, and it's like kind of, it's not necessarily always a bad thing, like that the hips aren't super wound up tight. But then what happens is like you lay in positions where it's like it kind of goes past its normal range of motion and it can cause like agitation in certain areas. And
Right.
so we'll go through and we'll just do this, because the other thing that it's on the outside and then the inside of your leg, you're describing nerve pain, but you're also potentially describing something where even if the hip is in alignment now, there was like maybe a history of the hip being elevated, and there's like kind of a pattern still in the soft tissue of that elevation. Most times where you see that is usually on the inner thigh or the outer thigh. And so usually more the inner thigh. But we're going to play around with something. Let's just see how this makes you feel. And it's something you can practice. I mean, we're going to go deep on this like later, like most likely in study groups, but even doing this actually helps reduce stresses and tensions in the body, and actually helps to relax the brain and the mind. And so it has actually even a psychological impact. Not that the brain is causing any of this, but it just helps the brain just be more relaxed. You're able to fall asleep easier. You're able to relax the mind, or disconnect from a situation that maybe you're working on or grinding on. You're just basically dealing with opposition. And so when we have a lot of opposition, even in misalignments in the body, I'd almost say especially in misalignments of the body, it throws off our mental processes, because the mind is trying to resolve that opposition, that conflict, even though it's just postural alignment, and so yeah, let's see how this treats you.
Okay.
So we're going to do one leg at a time, just because we want it to be real deep on the one leg. Okay, so your left leg, let's have everybody do their left leg. We'll do them both, but do your left leg. Do from the top of the leg all the way down to the kneecap. You're inhaling with your awareness on that left leg, that whole front side of the leg. Taking long, slow, deep breaths with your awareness on that front leg. Everybody has an oil or? Yeah, okay. Keep taking long, slow, deep breaths. This is one of my favorite things to do, by the way. Like when I'm watching a movie, I do this oppositional stuff in my body. I have one because of all the crashes and injuries and things. I have the worst pattern in the body where everything is like in opposition. And so I have to constantly do things to unwind it. And it's just, it's so soothing. Now, same leg, you're going to the back of that leg. So from like the bottom of the butt cheek all the way to the back of the knee, you're inhaling on the whole back side of the leg. You're still inhaling on that back side of that leg. Now go back to the front side and do the front side again. And you're on the back side of the leg? Okay, now go to the inner thigh. So all the way up to the bottom of the pelvis, down to the side of the knee, but on the inside of that thigh, the inside of that leg. Now go to the outside of the leg. So the side of your hip all the way down to the side of your knee. Go back to the inner thigh. And go back to the outer thigh. Okay, now take a moment and just stand up and just kind of feel the difference between the two legs. What do you notice?
My right knee, like extra right there. But my ankle on my left leg is actually almost hurting now.
So, okay, so Samantha said that like her right knee now didn't feel tight before, but feels tight. It was the same amount of tightness it was before, but
Mhm.
because the left one feels better, the right one's like, I don't know about this. Like, it doesn't want to participate, but we've done the thigh, so she's feeling it even in the ankle of the same leg. Now, here's the issue is you're not just working with the muscles of that leg, you're also working with the muscles of the other leg. So we kind of transition into the other leg a little bit differently. So this is what we're going to do. Your awareness is on the front of that left thigh, but at the same time, it's going to be on the back of the right leg. So you're doing opposites you're doing double opposites, opposite front and back, and then one leg, the other leg. So front of the left leg, back of the right leg.
Full front.
Yeah, the whole front of the left leg, the whole back of the right leg. So your awareness is on your left front of your leg. And at the same time, your awareness is on the whole backside of your right leg. Samantha just informed me she thinks this is a brain exercise. Keep inhaling. This will help regulate things in your gait, like in the way you walk and your movement, like when you're laying in different positions. Okay, so now you're on the front of the right leg, the whole front of the right leg, and then the whole back of the left leg. Front of the right leg, the back of the left leg. Okay, and just let that go for a moment. Now you're just inhaling on your front of your right leg. You're just doing the whole front side of your right leg. That's it, just the front side of your right leg. And now it's on just the back side of the right leg, the whole back side of the right leg. Go back to the front of the leg, the right leg. You're on the front side. You're taking nice, long, slow, deep breaths. And then back to the back leg. That right leg on the back side. Now do the inner thigh, the right leg, the inner thigh, from the top down to the knee. Then go to the outer leg. Go back to the inner leg, the inner thigh. Your awareness is on your outer thigh. You're taking nice, long, slow, deep breaths on that right outer thigh. Okay, now do the inner thigh of the right leg and the outer thigh of the left leg. Inner thigh, right leg, outer thigh, left leg. And then switch the inner thigh of the left leg and the outer thigh of the right leg. Okay, now just be still. Notice how your body feels. Oh yeah, go ahead and stand and just see how your body feels. We're not done. We're going to do one little bit more. One more little tiny piece, but how did that feel for you? Feeling good. Your right knee doesn't. Your right knee doesn't hate this process anymore. Okay, so now there's these muscles in your low back that each side like opposes each other. For those of you with anatomy, it's the quadratus lumborum, but right now let's just call it the low back. So you're going to go to your low back, but you're only going to do one side of your low back. So let's do the right side. So in your low back area, you're just doing the right side. Now switch over and do the low back, but on the left side.
This can go back to the butt.
Yeah, good point. About the Mingmen area down to not all the way to the butt, like the top of the butt, like the top of the hip bone. You're just doing the low back area. Yeah, when we do this officially, I'm coming up with ways of being able to do diagrams for you guys. And then go back over to the right side, low back. Okay. This next piece a little tiny bit harder just because you have to, how we practice body awareness? You're going to have to do that a little bit. If not, just fake it. like the energy will get kind of in the area, but you're going, excuse me, you're still going to the low back, but you're going through the front side. You're going like through the area below your belly button to like where your underwear kind of comes up to the top part of your pelvis area. Like in that area, kind of move your way in until you feel some muscles in your back. You're trying to hit your hip flexors. So just kind of go into that area the best that you can and take some long, slow, deep breaths. Okay, let that go. Now go to your butt cheeks, like each side of your butt.
Both sides at the same time?
Yeah,
or-
both sides at the same time. Okay, and then just let's pause for a moment and see how you feel. Go ahead and stand up and see how you feel.
I'm not falling asleep. Well, hold on.
L- Your what? Your neck pains, knee pains gone. So I would do this a few times. Other oils that I didn't mention that you could use here are also terebinth. Terebinth, and there's a couple others. But anyway, so Robert, I would do this. I mean, this isn't like the full thing. We can really go deep on this and really do things to unwind the low back, which we are going to do in one of the study group things. But after you go through and do this, now, like I would do it several nights in a row, it's like 15 minutes, 20 minutes. And then after that, treat it with lymphatic oils like chakra root cleanser, lymphatic blend, something that moves the lymph. And that should reduce that pain or that tendency for those flare-ups quite substantially. And be it that it's your low back, the quadratus lumborum, the psoas, or a lot of times it's both, the hips down into the legs, because the legs will contribute to things going on up in the hip and back. It should help to unwind it, and then the moving the lymph out of that area helps that tissue to release and let go even deeper. And so when the lymph is really blocked up like that, the tendency is for there to be more trigger points, more muscles locking up, tension to be in certain things, the propensity for like spasms and things like that. So this kind of helps detoxify the area. You're detoxifying a physiological stress that can happen. I refer to it as the stress of fixation, like your body's being locked in a position that it can't break out of the pattern, and so it becomes like fixated in a certain kind of movement, in a certain kind of contraction. And until you either release the fascia or go through and do some sort of neuromuscular re-education, it's practically impossible to break out of the pattern. Like it's, you know, even when you do stretching and postural adjustments and things like that, it's just kind of there. Like it doesn't really shift a whole lot. So by going through and doing this, it helps to unwind the conditioning of past postural misalignments, or if there's been an injury, or if a joint is compromised, and then it makes it easier for the lymph to move through that area.
Okay, so
How does your leg and back feel right now, Robert?
my leg, the thighs feel better.
Mhm.
My back, no change. My right leg, no change. My left calf is calling. It's like
So
one
you
of
can
the
do,
six.
we can still do like the along the shins on the front and then the calves in the back.
Okay, and then
Yeah.
the insides and the outsides. Okay, so
Yeah, with the
that's
with the
easy.
lower legs, it's yeah, you have, yeah, because you were getting it in the peroneus area. Yeah, do front and back and then side to side. Yeah,
Okay,
yeah.
and then early on you said marjoram or pain relief neuropathic applied to the spine.
The spine and I would do the spine and down the back of your leg, even though it's each side. I would do the back of the leg and probably like the outer part of the leg. The inner thigh probably would respond better to like valerian or spikenard or vetiver or something like that.
Okay. And is that oil, ointment,
However you want to put it on.
any form?
Yeah, you could do it
Or
neat, you could do
lotion,
it, yeah,
body tonic?
any version of that.
Okay. Then the other question, when you say lymphatic oils, again, any version
Any
and
version.
applied to all those areas
Yeah.
that we worked on?
Yep.
Okay,
Yep.
awesome. That's wonderful.
Yeah.
Thank you.
Yeah. Let me know how that goes.
I certainly will. I'm looking forward to allowing this to shift so I can sleep well at night.
Oh, good. And it might even change like how you sit at the desk when you're doing your work and stuff like that. It might even shift your posture a little bit. You know, maybe not so much your posture, but like how your butt hits the seat. Like sometimes like where that is will shift things in your hips and your low back. And so I'd even pay attention to like how you're sitting.
As I'm sitting here right now, as you began to say that, I could tell that my back is sort of leaning toward one side, my upper back.
Right.
Which is it's not normally that way.
Right.
But that I know it's okay. It's just things starting to move.
Yes, the things starting to shift. Yeah.
Yeah, find a new normal.
Right.
Okay, thank
Very
you.
good. You're
That's
so
gonna be
welcome.
fun.
Yeah, it'd be fun to play with.
Yeah.
On that, just what you were sharing, someone said that pain sounds a lot like the pain I had just before I broke out with shingles. The PCP said it was the inflammation of the nerve that passes through the pelvis.
Mhm.
And the pain was also just on that left side. And then go ahead,